My name is Gina Kyle, and I've worked at Mary Lanning Lab for over 30 years. I started as a phlebotomist and worked my way up as a supervisor of phlebotomy and the CLAs. I would like to tell you that we're going to take you through a little journey from being drawn in an outpatient chair, also being drawn on the floor. We would identify the patients. They also have armbands, and we have tablets and labels. And we also have different equipment that we draw people with. We have different size needles for different patients. We have bigger needles that are in obviously a green color. Our black needles are smaller. We also have butterflies for little kids and babies. We try and use the best technique possible for each of our patients, depending on what age group and how their veins are. Sometimes adults we have to use butterflies on. Just depends on how they're doing, how sick they are, just the size of their veins. I'd like to go over some stats that annually what we do here at the lab. And the first stat that I'd like to talk about is in our inpatients. Over the last year, we've done over 18,294 patient specimens. That means patient tests and specimens on inpatients that have come through the ER, spent time at Mary Lanning. That's a good amount. Also, we have done over 8,000 outpatients that come into our outpatient draw room that we go out and service and take care of. Total number of laboratory tests that we've performed in the last year has been 584,505. Just letting you know that's a huge number we are very excited about. We also perform health fairs all year long. We go to the city of Hastings and perform a health fair. We go to the schools. We go out in the community and spread the word that we do health fairs. It's at a lesser cost. Certain tests are on the list that you can do. Maybe your insurance isn't covering them and you'd like to recheck something, you can come to any of the health fairs. We do one over here at Mary Lanning Rehab. We do it every other Thursday, and we service approximately 4,974 people, 4,974 tests a year. It's a great advantage, especially if you're having troubles with your insurance covering and you just need to have those labs checked. Also, we collect specimens from many different locations. We service St. Paul, we service Grand Island, Webster County. We go all over somewhat over the Tri-City area. And in a year's time, in 1 month, we make almost 400 stops at these different locations. And we collect 2,996 specimens from our outside locations. And that's just part of our lab that we service these locations and bring in the specimens. We have to register them and take care of them so it's billed to their insurance.
I'm Laura Swaley-Butner. I'm with Mary Lanning's lab. I've worked here for 21 years. And today I'm going to take you through drawing the lab draw and what we do in the lab. So normally when I have a patient, I'll bring them back. I'll have a little order. And this tells me exactly what I need to draw, so what tubes go with it. When I bring them back to this room, I'm going to pull different tubes. We have different colors. They each have different additives to them. So certain tests get run on certain tubes. So I'm going to pull those here real quick. And I've got my patient here already. Sanitize for a minute. And then from here, we'll take the specimens back to our lab and run them. So once the test tubes are here and they're done spinning, then the techs will come, they'll take the specimens out of the spinner and they'll take them to their various departments. So like hemo will run like your CBCs, chemistry will run like your CMPs, and those sorts of things, or like blood bank, they'll actually type and screen the blood that's correct for the patient who needs it.
So as Laura mentioned, when a phlebotomist returns the specimens to the laboratory, they are processed in centrifuges, or spinning as we sometimes call that. The blood tubes will then separate the red cells from the serum and or plasma, which is what we do our tests on. There are multiple tubes collected on patients because different kinds of testing requires different kinds of specimens. So if you've ever wondered why we're collecting so many tubes on you, it's because the various tests need various specimens. Between urine, CBCs need a whole blood tube, and then your chemistries, like a complete metabolic panel or a glucose, they need serum or plasma. So these specimens will then be sent to various departments within the lab for that particular testing. So this is where we do urinalysis for patients. The one aspect of this analyzer runs all the chemical testing for the urine, which can tell if you have glucose, blood, protein, things in your urine. And then we have a second aspect to this analyzer, which does an automated microscopic, so it can also look at lots and lots of cells and kind of gauge what cells are present and what aren't. And then also in the end, we can look at that under the microscope and verify what this analyzer is seeing and ensure our patients are getting, again, good quality lab work on all of this.
Back in the microbiology department, we will take a lot of different patient specimens. We can do anything from urine specimens to respiratory specimens, blood specimens, pretty much anything that can come out of the body, we can do something with it back here. We mainly do cultures, so anytime that we're worried about a bacteria kind of causing an issue in the body, we're able to put it on some media that we have, and that media will go ahead and help nourish that bacteria, make it grow really well, and we can see if it's pathogenic or if it's normal bacteria that we're supposed to have in our body. After that, we're able to put it on a panel, set it up, incubate it for a while, and that panel will tell us what antibiotics will help and what won't, and we get that to the provider to help for the patient. Otherwise, some of the quicker stuff that will happen back here is our molecular. So we have two platforms. We have a Cepheid and a BioFire. We love them back here. They do a lot of our quick work for us. The Cepheid will do some shorter panels. So we can do things like tests for flu A, flu B, RSV, COVID, strep throat we can test for back here. All those things can be done within about 45 minutes. So once the provider swabs either your nose or your throat, brings it up here, and we're able to test it and get those results out very quickly. The other things that we can do is test full panels, like on our BioFire, that goes a lot more in depth. I think there's about like 27 or so different tests that we can do off that panel, and that one's about 45 minutes as well. So we're able to give those quick response turnaround times for the provider to help our patients out. Other things that we can do back here for molecular can be blood cultures. So patients are really, really sick. Blood cultures come back here from the lab. We incubate those. If anything goes positive, we will do a gram stain on it, look at it, see what type of bacteria is there, and then we're able to put a sample of that blood on our BioFire, and it will tell us in approximately like an hour, 15 minutes or so, what type of bacteria is there, so we can give that prelim to the provider instead of having to wait for the full 24 hours or so to get growth on our plate, which then we can put on that antibiotic panel, so then we can give results. We're able to give a prelim of it, so then patients can get quicker diagnosis and treatment, so we can get you guys better and go home.
I'm Stephanie Welsh, and I am the transfusion medicine lead tech here at Mary Lanning. And transfusion medicine is responsible for making sure that patients get transfused red blood cells, platelets, FFP safely. And also we provide frozen tissue products and bone products for surgery, depending on what their needs are. We give probably about 1,000 units a year. We perform testing on over 2,000 patients a year. And a lot of that is this kind of manual testing that we do. We also have instrumentation that can do some of this for us, and that is really helpful to kind of keep us moving when we're really busy. Another one of the things that we do in blood bank is the mother and baby kind of testing, where moms that come in to deliver, so we do blood types on everyone to see if they're candidates for RhoGAM. That is a product that we give to moms who are Rh negative and helps prevent them developing an antibody if baby is Rh positive. Historically, up until I want to say 1950s, 1960s, women who were Rh negative that carried Rh positive babies generally would have one healthy baby, and then they would have a second baby that was maybe kind of sick, and that might be their last child because of the antibody response that they had to those O positive or Rh positive cells. Now we have this product that we just give them a shot. It's a 2 ml shot, and we have eradicated that problem for mothers and babies now through blood banking research. So here we're going to look at a patient who is, turn on a little light, a patient who is A, blood type A, and we put patient red cells in with this little blue reagent, and if the patient has the A antigen or is blood type A, it will, what we call agglutinate, looks like a tiny little dot, and that would be a positive reaction. This is what a negative reaction looks like if the patient's cells tested with this anti-B reagent do not react. So we would not anticipate that they would, if the patient was A, we wouldn't anticipate them to react with this. So, and then that's patient red cells. We also test the plasma portion of the blood. We spin it and separate it. And the plasma portion should correlate. So we test the patient plasma against A cells. And since the patient is A, they should not react because they shouldn't have antibodies present to something that they already have on their cells. Where they would react here positively, so you would get that nice little red dot again, with B cells because they do not have that B antigen on their cells. So this is how we do just kind of a basic blood type determination. We also perform antibody screens to give the safest red cell transfusions we can. The instrument does a lot of that for us. We do a lot of confirmed testing here at the bench in the tubes.
Hi, I'm Ashton Lammers. I'm a histotechnician here in our pathology department. In pathology, we receive anything that's removed from the body, whether it be done in surgery, in ultrasound, CT, or at a clinic. We also receive specimens from other locations in our area. In the last year, we processed 36,000 H&E slides. After the specimen is grossed, the grossing tech places it in a cassette that looks like this, and then it processes overnight in a machine, and the next morning we come in, we take it out of the cassette, place it in a mold with wax, and then put it on our microtome, and we cut it between 4.5 and 5 microns thin. After that, it is placed on a microscope slide and ran through a stainer, so then it looks similar to this. These are different biopsies that we have done. So right here, like, is a tonsil. Here's an eyeball we've done in the past, an appendix. These are just some examples of what we do. After that, we take it to the pathologist. They diagnose, or if they decide they would like cancer stains, we do what we call immunohistochemistry stains, which test for different antigens and tumor markers, which helps doctors determine what kind of treatment they would like to do. Then if they decide they need to send the case out, we get that taken care of, or they sign it out, and then the doctors can treat their patients.